I think the VA is doing a tremendous job in a number of different areas.
Last year, we did 2.3 million telehealth encounters with nearly 1 million individual patients. And that's one of the biggest numbers you hear of any healthcare provider.
Getting out in the field, understanding how veterans need to interact with us in VA, again, whether digital or non-digital space, rather than burdening them with having to figure out our organizational chart is really the goal.
There is nothing that doesn't have an IT component in terms of all of our modernization efforts. And you have to look at what we're doing differently within the VA to address that. And, you know, this is not your mom or dad's VA anymore.
The VHA Innovation Ecosystem has a number of projects that they focus on, and they really try to help bring cutting-edge technology, business process modernization, and everything in between into the hands of the people that need it the most, whether that's the employees or the veterans that are using our services at VA.
It is such a cool time to be in IT in the VA because we have at our fingertips the ability to directly serve the veteran with really modern digital services, mobile services. We can service veterans in ways they've never been serviced before.
It's a lot about self-service. How do we enable veterans to do as much of the healthcare, such as scheduling an appointment online or secure messaging their doctor, doing a chat with a doctor to triage a problem before necessarily having to go into an appointment?
The way that we deliver healthcare in this country, I think, can leverage digital products a lot more than we have historically. And by kind of forcing us into this situation of needing to get creative and expand the use of the toolkit that we already had in place, luckily at the VA, we've actually just seen an explosion of ideas about how we can treat patients in a way that doesn't require them to come in person and have an appointment with another, a doctor in person.
I think that the Veterans Department, like every other department, this is a much different world than it was even 10 years ago. And so we have different technology that's out there. We have an aging veterans population. And then we've got all of these young people that are coming on board also. So as a result of that, we just have to adapt.
Good morning and welcome to our House Oversight and VA Digital Modernization virtual event. My name is Michael Hoffman and I'm the president of GovernmentCIO Media Research. GovernmentCIO Media Research is the online destination for thought leadership and research focused on the transformation of government IT. Our experienced team collects the best practices and research regarding the advancing technology and management landscape. As a veteran myself, this morning's topic holds special meaning as we will discuss how the VA is using new technologies to support veterans at an especially difficult time in our country's history. The global pandemic has transformed so many lives and hit the veteran community especially hard. We're honored today to be joined by the two leaders of the House Committee on Veterans Affairs, Chairman Mark Takano and Ranking Member Phil Rowe. We'll also be joined by some of the VA's top leaders in IT who will talk about how the VA has made the incredible digital pivot to provide services to veterans virtually versus in person. To get an idea of the change that has occurred, one statistic really jumped out to me. From February to May, the number of weekly telehealth appointments on the VA's Video Connect platform jumped from 10,000 to 120,000 appointments per week. It's staggering to see the changes that have occurred almost overnight. So we'll dive into these changes and talk about the solutions the VA has adopted to ensure veterans receive the benefits they've earned and receive the support they need. Before we kick off our program, I'd like to thank today's sponsors, Dell Technologies, VMware, Worldwide Technology, NetApp, and Salesforce for underwriting this event and making these important conversations possible today. Without our sponsors, we wouldn't be able to bring our audience valuable content like this morning's virtual event. I also want to remind audience members that you can submit questions for our speakers in the comment box you see below the video player on your screen. Our editors will choose some to ask during the conversations this morning. I also want to encourage everyone to participate in the conversation on social media. Without further ado, we'll start our program by introducing Chairman Mark Takano to the virtual stage. Chairman Takano was elected to Congress in 2012 as he represents the 41st District of California, which is home to the March Air Reserve Base. He served on the House VA Committee before he was elected as the chair in January 2019 and has served in the capacity since. Chairman Takano has been focused on ensuring veterans receive proper care during the pandemic, protecting the GI Bill, and reducing the suicide rate in the veteran community. Chairman Takano, thank you for joining us.
Oh, my pleasure, Michael.
All right. Well, thank you so much for your time this morning, sir. We're really excited to have you and get your thoughts on where the veteran community is, some of the support that's been provided during this especially difficult time. So I really wanted to take advantage of our time this morning and kick off there and ask you, where are some of the biggest impacts that you've seen for veterans since March, when the global pandemic really started to hit and the effects really started to hit this country?
Well, one of the things we've been working on even before the pandemic hit us, late February, early March, was veterans' mental health care. I set as a priority to deal with suicide prevention. This pandemic has isolated so many of us. And for veterans who may already be experiencing PTSD, it's an added challenge. And that's why I worked with the VA to expand telehealth care and worked on legislation to support veterans in crisis. But we all have to do our part to reach out to our veterans. And I just want to take a moment and share the Veterans Crisis Line. If you or people listening or a veteran are struggling, I urge them to contact the Veterans Crisis Line 24 hours a day, 7 days a week at 1-800-273-8255 and select option 1, or text 838-255. And so many of the veterans that that are enrolled in the VA healthcare system who were in mental health treatments or in various groups, that all now have to move to a virtual platform. And as did most of the in-person medical appointments, there was a massive move toward telehealth. The pandemic impacted our student veterans on the GI Bill. Many, I would say almost all schools shut down in-person instruction during that time in March and April. And suddenly they had to move to online courses. Those courses weren't accredited in many cases, in most cases. And we had to pass emergency legislation to waive the normal, because there's a difference between in-person and online instruction. There had to be some quick authorizations passed to allow that switch to happen without the student veterans being in danger of not being able to have those courses count toward their degree. And also, many students were now in a situation where their programs just shut down. They couldn't move certain training programs, for example, into an online format. Mm-hmm. And they were in danger of losing their housing. Students could no longer go to their work-study jobs because those jobs just weren't there and they were counting on that income. So we had to pass legislation that would allow those student veterans to continue receiving that work-study money as part of their revenue, their personal revenue coming into their household. But the bigger picture thing is that I want to remind everyone that the VA has a fourth mission that calls on VA to act as our national backup healthcare system. And we saw in the early stages of the pandemic, and even it erupts even now and then, that we saw some state veterans homes being overwhelmed, even private sector nursing homes being overwhelmed with infections and tragically huge amounts of deaths. The VA will come in to a situation where a locality has an overwhelmed healthcare system. And this is normally done in the case of a hurricane or an earthquake or a fire where the local health systems are stressed. VA is part of that emergency backup system. And that's what is known as the fourth mission of the VA. And so, I work diligently with, my Republican colleague, Ranking Member Rowe, and we made sure that they were and are able to care for both our veterans and the larger public during the COVID-19 pandemic. And that's why I advocated for veterans and secured a $20 billion sum in the CARES Act to ensure that VA was prepared throughout the crisis. The first mission was taking care of veterans and their healthcare needs, but we also had to account for the added responsibility of VA to move into areas of the country where there were huge stresses on the healthcare system to actually take care of civilians as well.
Yeah. So, Chairman Takano, how have you, from your judgment, how has the VA taken this on? This has been almost a situation overnight where they had to do a massive change, whether it be both telehealth appointments, as I mentioned in my opening remarks, go way up. And at the same time, the pivot to telework. So a large portion of their workforce can't work in the places that they had become accustomed to, and have to adapt, like a lot of us, myself included, working at home with kids or other loved ones, and trying to take on just this massive challenge. How have you seen it from your perspective?
Well, because of the pandemic, VA has had to rapidly expand their telehealth care options to ensure veterans could continue to access the care they need. Mm-hmm. We had a hearing in June to examine their progress so far. Gosh, it's already September. June is, wow. Time is also something that's changed. That's our sense of time during this pandemic. But we're pleased that VA was able to rapidly expand telehealth capacity. I have to compliment them on that. We were able to support supplemental appropriations for these efforts through the CARES Act. So the CARES Act anticipated their telehealth needs. During the pandemic, approximately 80% of VA activities have shifted to telephone and video. Approximately 1,000% increase in telehealth capacity in the first 3 months of the pandemic. And after that expansion, VA has a capacity for 15,000 concurrent calls. Those calls are happening at the same time. Now, we will be overseeing where VA takes telehealth from here. VA has been a leader in telehealth, and it's poised to continue being a leader. We would like to see VA make an increased effort to reach underserved communities that can benefit from telehealth, such as Native veterans and women.
Mm-hmm. You mentioned earlier about suicide prevention, and that's been something that you've been consistent throughout your chairmanship. One of the things that I've seen is the normalizing of being able to do some of these telehealth appointments from a mental health capacity, and making that more accessible and less intimidating to going to, say, going into an office and sharing some things, that doing it from your own home. Do you think that will increase potentially the amount of veterans reaching out for help, and maybe normalizing that process in a new way?
Well, conceivably, yes. We'll have to see. I mean, that we've been forced by the situation to rely more heavily on telehealth, and it's been an opportunity for us to try different ways to reach our veterans who have mental health care needs. Mm-hmm. But I remain concerned that it can't replace some of the in-person groups, and they have these peer support groups that the VA facilitates, and individual appointments. So I think the jury is still out on that, about whether or not this is a better form that that many veterans are going to be able to access mental health care that didn't before. I'll tell you, I'm very hopeful that the legislation that we're poised to pass in an agreement with the Senate is My Access Act, which clarifies that a veteran who is experiencing suicidal ideations or an emotional crisis can call that crisis line, the number of which I gave out earlier, and get evaluated and put into an emergent care immediately and not have to worry about a bill. This applies to all veterans with very, very few exceptions. I was not able to get an agreement on veterans with dishonorable discharges, which constitute less than 1% of the discharges. Nevertheless, I think veterans knowing whether or not they're eligible for the VA or not, I mean, whether they are actually enrolled or not, can call this crisis line and know that they're not going to have to worry about an adverse financial consequence. I think that's going to, decrease the likelihood that people won't seek care. And it's just another avenue out there. And I think that's a significant step forward in terms of suicide prevention among our veterans.
You mentioned some of the resources that you were able to have the VA receive through the CARES Act. As the pandemic continues and the VA continues to make mass support this veteran community, what additional resources could you see the VA continuing to need? And as you are continuing to work with them hand in hand, where do you see that next step there in potential additional legislation and additional funding?
Well, I think we are seeing that much of the $20 billion or the $17 billion or whatever amount it was $20 billion that we got supplementally for the VA has been, not all of it's been spent. In fact, the vast majority of it is still remains unspent. But in my conversations with the VA, I think we're looking at a significant increase. Well, we know there's been a significant increase in unemployment among all Americans. Among veterans, it's tripled from about 2.5% pre-pandemic to close to 8 to 9%. And that is going to have a downstream effect of more veterans being unemployed, more veterans losing their health benefits because of the fact they're not all employed. And that's going to cause many veterans to turn to the VA for their health care. So we're anticipating an increase in utilization in the next year. I think that's a big concern, perhaps the largest of the concerns. I'm concerned about what kind of stress a potential surge this fall of infections will have on the VA's workforce. So those are kind of, I think, the salient points, the salient concerns. But right now, the VA has not run out of the supplemental money, far from it. But I think the big challenge will be this fall in terms of a surge in infections among the American population and the increase in the numbers of veterans utilizing the system coming into the next year. A bit of good news. The VA. I harp on the VA for the somewhat 50,000 vacancies in the VA healthcare system, and the VA has reported to me that they've been making significant progress in staffing up the VA and hiring medical personnel. I'm trying to do a deeper dive with them to understand whether these are permanent employees or they expect them temporarily. They assure me that they're more permanent. I just want to make sure under the emergency authorities that they're using to expedite all this hiring, that there's no corners being cut, and that all of the certification and credentials are all proper. But that's one of the upsides, is that the urgency of the moment has moved VA hiring. But look, I also think we're going to, with the veteran population and the general population, there are going to be some tremendous needs in the mental health area. We're going to, I think, need to address a lot of mental health care needs of the American people and our veteran population. We need to be able to build that workforce, plan for it now.
Okay. Well, Chairman, I believe that's all the time we have for this morning. Thank you so much for joining us. Really give us a great perspective on your views, especially from Congress in that regard. So thank you so much for joining us.
Thank you, sir.
All right. All right. Thank you very much, Chairman. All right. Well, up next, we're going to be joined by a top federal healthcare leader, Maheen Mirza. Maheen is a director of federal healthcare for Dell Technologies, where she is responsible for a portfolio that includes enterprise systems, client solutions, software, and services. She works with the Department of Veterans Affairs, as well as the Defense Health Agency, Health and Human Services, and the Social Security Administration. Maheen, thank you for joining us.
Mike, thank you for having me.
All right. Well, let's start off. You were able to join me a little bit last week, and we were talking a bit about the work that you and Dell Technologies has done with the Department of Veterans Affairs. And the chairman was talking a little bit about that pivot as well, as that ramped up into telework, as well as telehealth. So could we start off and could you tell me a little bit about some of that work that Dell has done through that transition to make sure that the VA and some of the other agencies, but specifically the VA, were able to do just that?
Absolutely. Our world has gone through an unprecedented crisis in these last 6 months, and it has impacted pretty much everything that we do in life today, including the way that we work. I think there was a report published by the OPM focusing on fiscal 2018 data that actually highlighted the fact that only 22% of federal workforce was actually working remotely. And obviously in the last 6 months, all of that has changed. And Dell has played a big part in helping the government transition to the new normal. And then specifically for the VA, we work very closely with various work groups, but specifically also with the Office of Strategic Sourcing to ensure that we help the department deploy thousands of endpoints in a relatively short time period, which not only allowed them to maintain the day-to-day operations, but it also allowed them to continue supporting some of the key telehealth initiatives that you were previously mentioning, such as the program for the homeless veterans. You talked about the health crisis line, the mental health crisis line, and having access for folks to be able to call into that. We helped with all of that. And honestly, when I look back at what was happening in March and April, there were a couple of reasons, key reasons why we were able to be successful. And the first one, I really have to give kudos to the Office of Strategic Sourcing, because it was clear communication from their side in regards to the requirements that the VA had. It was coming from OINT leadership in regards to the strategic mission of the VA, which is always very, very important, but it was further amplified because of the activation of that fourth mission that you were talking about a little bit earlier, which is that the VA is actually the backup healthcare system for all of the US, for all of us as private citizens. So that was very, very much amplified. And then honestly, the last thing was the engine of Dell. I was very proud to work for Dell because everybody from executive management to our operations team jumped in to flawlessly execute. We had to work overnight in regards to secure supply chain. We had to work all of this during an unprecedented and extraordinary time where there was global demand for devices in order to enable telework and in order to enable telehealth from a healthcare industry perspective. And we were able to do it due to the prioritization that we put together and due to the overtime work that people put together in order to make sure that VA's mission was being accomplished, right? Not only it was internal Dell, but it was also our vendor supplier partners, because even they were going through supply constraints that we haven't seen before. And then all of our industry partners that work with us in order to enable the VA to accomplish everything that they did in the last 6 months.
Yeah. And one of the things you really highlighted was the transparent communications with the Office of Strategic Sourcing. And we're really happy to have Luwanda Jones, the Deputy CIO from that office, joining us a little bit later so she can talk a little bit more about that. But could you talk a little, I think that's a real touch point for a lot of our audience, even outside of the VA this morning, about that transparent communications in a time, such a pivotal time when there was such a pivot occurring.
Yeah, I mean, definitely. Luwanda and I have spent some time talking about this. And most certainly, I think the first thing that VA did was set up different task force for everything that needed to get done in order to ensure that they could actually combat the increase that was coming from workers not coming into the office and from everything that they would have to do to transition their services to a telehealth perspective. I think the very first step that they did was take inventory of what needed to happen. Then they looked at industry partners to see who could help them in terms of vehicles and inventory to support their supply. And then they had transparent meetings that spanned sometimes on a daily basis with people on their team and with the worker bees on our side to ensure that there was a daily communication point in regards to what was happening in the world, what was happening from a secure supply chain perspective, and what was happening from an inventory perspective. At any given point, we actually accelerated our work with the VA to go from single-digit outputs to thousands of outputs on a weekly basis so that we could keep up with the demand that the VA had.
Mm-hmm. Yeah, so the VA has been a real leader in a lot of ways in this transition and within this pivot. What are some of the other? How have you seen the transition play out in other agencies across the country?
And everybody is different, right? I mean, ideally, what is happening in the industry globally and what is happening with other federal agencies, it would be a multi-year journey, which has been very quickly accelerated. Most of the agencies have developed mission capabilities and discovered that they could securely and efficiently telework in a matter of months, if not weeks. And some of it is going to be staying as we move forward. We worked with the federal government along a number of different facets. Even if the work started with remote worker capabilities, it spanned to true workforce transformation and it transformed to digital transformation with some of the things that are happening around cloud and specifically hybrid cloud. To put it in perspective, and just to give you some examples, we work with the Department of State to modernize the backend that was actually supporting some of the remote work. And we work with them to modernize it with software-defined hyper-converged infrastructure that allowed them to gain tremendous efficiencies from a backend support and a backend integration efficiency perspective, right? And the DOE, even though the DOE started off with the initial surge of devices, they didn't just stop there. What they did was then they wanted to continue to optimize their technology for remote work. And they tried to focus on creating things such as digital personas so that they could focus on the different unique requirements of their user groups and make sure that they were setting the stage for success. I think when you think about what has happened in the last 6 months, nobody could have predicted what 2020 brought to us, but modernization has been an imperative. I think the one silver lining has been that the work that has been done around digital transformation would have literally taken years, if not decades, to achieve. It has become much more rapid from that perspective. And what we see really changing is not only the telework, the remote operations, but essentially we see cloud being a much more multifaceted, multifaceted solution that every agency is looking at. But you have to be very careful in regards to how you handle the cloud.
All right. Well, Maheen, I think that's our time for this morning. But thank you so much for joining us. Really interested in learn more exactly about how Dell's working with some of these agencies, especially the endpoints, communication. It's such a pivotal time for the country. So thank you very much for joining us.
Not a problem. Thank you very much for having me. Appreciate it.
Thank you, Maheen. Up next, we're going to hand it off to Tim Cox, Senior Director at GovernmentCIO, who will be leading the Strategizing Technology for the Veteran panel. He'll be joined by Dominic Cusat, the VA's Principal Deputy Assistant Secretary and Deputy CIO for the Office of Information and Technology, as well as Susan Perez, the VA's Executive Director for IT Program Integration and Chief of Staff for the Office of Information and Technology. We originally had VA CIO Jim Jaffer scheduled to join the panel, but unfortunately his schedule called him to the hill this morning. So Tim sends his, CIO sends his regards, and we'll have to learn more from him a bit later. But we're really excited to have Tim kick this off with the panel with both Susan and Dominic. So I'll hand it off to you, Tim, and take it from here.
Hey guys, good morning. Mike, thanks for the introduction, and I couldn't be more thrilled to be here this morning with Dominic and Susan, doing some really awesome things at VA, continuing the work and carrying the digital strategy forward. So we'll just jump into the dialogue, and Dom, I'll start with you, if you don't mind. The OIT mission and vision center around the veteran experience, and the work you all have been doing is really remarkable, dating back way before anything happened in 2020 that needed to be worked around. So to get the conversation started, could you share a little bit about where VA is driving veteran-focused IT services as part of the larger digital transformation?
Sure. Thanks, Tim. So happy to be here today. So VA, is a very large enterprise. So a lot of folks don't realize how huge it is. We service up to 20 million veterans plus, and we've got about over a 400,000 person workforce. So it's a big enterprise. It's one of the biggest in the nation, one of the biggest networks in the nation, crossing all of our states and some of our territories. So it's a lot to get your arms around. And then you heard Chairman Takano mention earlier about our fourth mission, where we're also the backup healthcare system for the United States. We can also act as a backup to the Defense Department in times of crisis to handle patients. So it's a big mission with high stakes. We take IT support to this mission very seriously, as you can imagine. And as you know, these days, it's very hard to do any kind of mission without IT. Most of industry realizes to remain relevant and remain responsive to their missions, they have to embark on a digital transformation and even sort of become an IT firm in and of itself, even if historically they weren't really providing IT services. So in order to do that, we embarked on a VA digital transformation a couple of years ago. And I will say this all didn't just start 2 years ago. About 4 or 5 years ago, we embarked on an IT modernization effort within the VA. So we sort of we knew it was more than just modernizing. So we sort of built it out a bit, built on what we were doing, and created a more comprehensive VA digital transformation. With our goal to focus on our Secretary Wilkie's primary objective of customer service and customer experience. So what we want to do in IT is not IT for IT's sake, but IT that's going to create a positive impact on the veteran and their lives and the care of them and their families. And we want to make sure all the funding we get for IT and VA, we're getting the biggest bang for our buck in terms of not just building IT or modernizing IT, but getting that outcome for the veteran. So I thought it might be helpful to go over the 5 main objectives of our strategy. The first objective is to provide exceptional customer experience. And that goes not just for our workforce. Our workforce has to conduct the services that the VA is vested to do. But they, from a day-to-day perspective, have to use IT to make those services better and get them out there in a more agile way. But then our customers are, of course, the veterans, because a lot of our IT services reach directly to the veterans. So job one for our digital transformation strategy is to ensure an exceptional customer service. Secondly, we're looking at IT modernization, making sure that this digital transformation is supported through the use of modern commercial best practice software and infrastructure that meets the customer's needs. We want to really leverage the best and the brightest that are out there and stretch the limits of what VA can do with our infrastructure. Thirdly, we've developed a strategic sourcing model and office where you're going to be hearing from our deputy CIO for strategic sourcing a little bit later, that, VA has a lot of buying power. They're very large. We're very large, and we have a good sized budget. So we need to make sure we're good stewards of that budget and leveraging that buying power in industry. So we want to be strategic in how we do acquisitions and procurements and make sure we're using all the opportunities that are available to us, buy smarter, do investment management, make sure we're, again, focusing on those outcomes. What is the goal? What are we going to get out of this? And how can we gain economies of scale and get the most use out of, buy once, use many. So being strategic in our sourcing is very important. Fourth is our workforce. And I believe you heard Chairman Takano mention that earlier too. We can buy all the best, most cutting edge technology out there for the VA. But if we don't have people who understand how to use it effectively, how to manage it, how to configure it, how to secure it, it doesn't do you any good. You're not going to get the worth and the value out of it. So we've taken the time to invest in our people and our culture and really better define their roles in our IT workforce, and then better define what the professionalization qualifications are for those jobs, get folks trained, certified, do some succession planning, where we use all the tools available to us from a recruiting, retaining, training perspective to build a top world-class IT workforce for the VA. So that we can get the most out of our infrastructure and be the most efficient in developing and deploying it. And finally, the fifth item is achieving seamless and secure interoperability. We need to make sure the data that we have vast troves of data, huge data lakes. VA has probably one of the largest caches of data in the world for the care of our veterans and their families. And we need to make sure that data gets to who needs it when they need it. It remains intact as it travels there and is secure. We take securing our veterans' personal and private data very seriously. So that's a key tenet, is that whatever we build, it needs to really support that seamless and secure interoperability, and not just throughout the VA, but with our partners like Department of Defense as we build our new electronic health record system and modernization, and other federal and commercial partners that we're partnering with to get services directly and efficiently to the veterans. We need that data to pass. We need to use the strength of the data to support the veterans. We want their data to help them. So we need to make sure we have an infrastructure in place that gets it where it needs to go, interfaces as it needs to. And I think you're going to hear a lot about that as we go through the course of today. So in terms of COVID, we think that this IT modernization and then subsequent IT digital transformation set ourselves up nicely to be able to withstand the demands of COVID-19, how we had to move to a very virtual workforce. We had to support telehealth, telecounseling, telehearings, telework for our workforce. So I think because we had all of these efforts afoot, it positioned us nicely. And you're going to hear from Susan Perez, who was our lead for facilitating the whole COVID effort for the CIO's office, about some of the specific things that we were able to do because of this transformation. Yeah, over to you, Susan, if you'd like to share some thoughts on that.
Yeah, absolutely. Thanks, Dom. And I think actually setting the stage on how much we had going on in our strategic objectives beforehand, like you said, really postured us to do well for COVID response. And the incredible thing with what was going on at the time, I mean, I remember the IT leadership, they were pretty much out in California doing what they needed to do, right? Working with technology communities to continue, right? Develop our strategy and our development work. But here we started getting that antenna raised about what might be potentially going on in the COVID space. And so right away we knew to take this divide and conquer, right, approach so that we could leverage all of the great things that we had put in motion with our strategic plans. We also, I think, had some good lessons on testing ourselves in advance of it really taking off in a way that affected the nation the way that it did. And we were able to scale. We were able to scale very quickly to make sure not only our typical workforce would be okay to work in that remote posture, but we scaled so that if we had to have every employee go into a telework posture, that we could support it. And that was very deliberate testing and scaling, which we took seriously because we didn't know. Even our medical community, while they were trying to be boots on ground, they didn't know at any point in time. Doctors were becoming ill. That made the work that we had to do in the telehealth department go up exponentially, always on the roadmap. You know, like Dom had mentioned earlier, these things were always on the roadmap for modernization, but it just happened in an exponential way because of what was going on with COVID. And it proved out to really be something that we could demonstrate could be successful in interacting with our veterans and the patients that our clinical community gets to see. Tim?
Yeah, thank you. That's really good. I want to pull on the thread a little bit. I know in recent years, and Dom talked to the IT modernization efforts that really set the foundation for moving the strategic plan forward, the digital strategy forward, and that you have built upon. 2020's thrown a lot at the nation, at the VA, at IT, in support of the business partners and service to veterans. I think, from my lens, we're impressed by how effectively the department, was able to pivot. And I won't say respond or react because I don't think those are the right words. And I think you alluded, to the reasons for that the good planning and stewardship up front really set the course. But you've been able to lead through it all, and that's a testament to both of you, to the CIO, up to the secretary. I mean, how did COVID, the COVID response or the need for a response impact the digital transformation, if at all, accelerant, et cetera, for things you're already working towards, and how, how that occurred?
Yeah, actually, I'll start, and I know Dom will have many more things to add, but I will say COVID accelerated for sure. The planning was always there. We were in motion to do some of these good things, but definitely an accelerant for some of the items that we had on our plate, and customer service being at the forefront, right, to make sure we were shoulder to shoulder responding to VHA's needs. And they came in, on a Friday with a certain plan, and then things happened in the background and they replanned over the weekend, and it accelerated us on that Monday to kind of react to it. But we couldn't have reacted, right, air quote, if we didn't have the other planning. The telehealth pieces that we were accommodating to were over 1,000-fold, if you think about that. And if you think about the number of telehealth visits that we've accommodated just from a January to end of August timeframe, being over 3 million was huge. It was an astronomical growth. but again, a successful one. The scalability, the adaptability that we had in the environment because of things that we had put in motion. I mean, Dom, certainly I want you to kind of add in, because we had so much of this digital transformation in play, and these all really fed to things that we were able to leverage immediately for COVID. So I know you have some areas you want to cover as well.
Yeah, great. Thanks, Susan. Good question, Tim. COVID, in 2020 in general was interesting timing because of where we were in the digital transformation. It allowed us to prove out a lot of what we had suspected were the most pressing needs of the VA and the things that were going to position us for success. So it kind of, as you mentioned, Tim, that accelerant, I like that word. It proved to be an accelerant to show that we were on the right track. So let me give you some examples. Like because of this transformation, for the first time in recent history, we have a clear understanding of what our enterprise architecture looks like, what's hanging off of it, and what our technical debt looks like. We can paint a very vivid picture of what VA's accumulated technical debt looks like, and we have a plan to remediate that technical debt within 3 to 4 years, if with the right investment and sustainment investment to not only fix it, but keep it fixed and keep us cutting edge. So throughout the course of that, we drove movement of VA to the cloud. We were one of the biggest entities in government that really pushed a move to the cloud. We established our VA Enterprise Cloud with great commercial cloud partners. We've moved hundreds of applications and services into the cloud. Having that cloud instance there enabled us to very quickly and agilely scale into the cloud and get that capacity we needed. We didn't have to build it out in the VA. It was there. That's the beauty of going to cloud type platforms, is that when you need it, you have sources of scaling. And then also we also adopted through this transformation a COTS first approach. So that allowed us to have commercial best practice products out there that we could leverage and then scale. So it wasn't, GOTS or proprietary infrastructure that we had to build out ourselves. That enabled us to very quickly and agilely work with our industry partners who, they really stepped up when we needed them through our strategic sourcing efforts. They came, they met with us exhaustively. We worked very creatively with them to think about how we could scale in a time when everybody was competing for those same resources. But our vendors really stood by their commitment to the VA. They worked with us, they partnered with us to get us the computing capacity that we needed, the end user devices that we needed, the bandwidth that we needed to meet the need of this incredible surge of telehealth and telework. And I'll also mention too, the digital transformation strategy helped us make sure we had the right workforce on staff to meet this need. They were ready. They were skilled and trained through our ability to do direct hiring for key and very skilled IT workforce. We were able to, over the past couple of years, ramp up and get some very skilled folks on board who were able to act very quickly and decisively to get our network ready. And oh, by the way, I just want to mention that over 60% of our IT workforce are veterans themselves. So these are people that not only have the skills and capabilities to provide world-class IT services, they are passionate about this mission because they are veterans themselves. And most of those who aren't in that over 60%, myself included, have many family members who are veterans. My father and my 7 uncles were all veterans, who most of them were in theater, and I'm here for them and their legacy. So and to repay their service. So it's a very motivated workforce. We were ready. This transformation program positioned us nicely. And one thing I can't hesitate to mention, being the former CISO for the VA, is our enterprise cybersecurity program. Security is very important. And because of our digital transformation strategy and our ECSP, that enterprise cybersecurity program, we were postured to do all of this securely and make sure we were able to support telehealth and keep personal health information and personally identifiable information secure, because we had those underpinnings and those security controls and security services in place to defend the network, monitor the network, and secure the systems that were carrying all this very precious information. So all of this kind of set ourselves up nicely. And to your point about accelerant, it helped us really accelerate some of the initiatives and really prove that we were on the right track as it worked.
Yeah, Susan, thanks. Just a follow-up. I think, the preparation and those foundational elements are pretty easy to see, even outside looking in. I'm sure you guys see that within the full department. But could you, and Dom, you talked a little bit about, the things that this situation has helped identify, and technical debt being one of them. With the right investments, how that plan will unfold. But could you give some examples of maybe where the COVID influx of funding allowed you to not be reactionary, but to actually apply those funds to the things you were already planning for that may persist and scale into veterans well beyond 2020 or whenever we're sort of back to quote normal?
Yeah, that's a really good point, because when we saw that the COVID funding was going to come in, we wanted to be smart with it. And we wanted to make sure we weren't just throwing money at the problem. We were thinking about, okay, what's going to position us to weather this storm? And not just this storm, but it's something we can scale up for this, scale back down, but put that infrastructure in place and those underpinnings in place that we could then use that investment and scale it back up again, because it's not just about pandemic response that we're dealing with now. There's natural disasters that occur. There's homeland security issues that occur. VA has no choice but to be up and ready 24/7, 365. We gotta provide healthcare. We gotta save lives. We gotta care for people's families. We gotta pay benefits to people who need them and depend on them for their livelihood. We have to take care of our veterans who have passed away and make sure they're respected and their families are respected and they're interred appropriately and in a timely way. So VA never sleeps. I mean, we cannot just put a pause on things. So we knew we needed to be very good stewards of those COVID dollars and not just put tactical things in place that were going to put Band-Aids on things or surge us up artificially. What could we do to invest? So we really thought about how can we increase our platforms into the cloud and that provide shared services and SaaS services out to the enterprise. How could we shore up that bandwidth and not only get it bigger, but more dependable? How could we make sure we're spending some money on security to make sure we could support things like telehealth services that are going out to our veterans where they can take their iPad or be sent an iPad and they can have a private discussion with their physician and share information and health information, and they don't have to worry about it. So, and that's something we can use in the future. I think what we're going to see is, we had a constituency both inside VA and out that were a little reluctant to do telehealth and teleservices because, there's comfort in the brick and mortar, the face-to-face interaction. And I get that. And like Chairman Takano said, we need to sustain that. Sometimes that's the best course. But I think people are seeing and getting a taste of the power of bringing these services out to veterans who are in very remote areas. Sometimes it takes them, I have one uncle, it takes him hours to get to the nearest facility, and he feels guilty for asking people to drive him there because he can't drive. So, we're showing the power of this, and I don't think there's any going back at this point. That, I think we've shown what this can do to be a force multiplier to get VA services out into the field. COVID funding helped us shore that up, and now we're ready for the next one, and we're ready to also enhance and increase the services we provide on a day-to-day basis. And I'm sure Susan has some great precise examples of some things that we did with those dollars, Susan?
Yeah, thank you. So, I mean, Tim, we've got a lot of great points that Dom already covered, but I do want to start with, and we're grateful, right? We're grateful that we were given some of the supplemental monies that were being passed out to help the nation. And that was certainly used in a complementary way to our appropriation, while we accelerated some things in motion and used some COVID spending on items like that. We also had a very leaning forward chief technology officer. And I know that you guys are going to spotlight Charles later on. His team was amazing in helping to drive some new innovative ways for us to interact with the clientele, right, with that veteran community. And some of those new digital tools, of course, all shepherding through, some based off of va.gov, but other things that they were able to put in place were simple things like vet text messaging that would go out. The text interacts with the veteran. I'm here for my appointment, right? And so making sure that proper social distancing was occurring safely, but they knew the veteran was there checking in for his or her appointment. They launched a chatbot. This chatbot was interacting as well, which helped really cut some of the call volume. In a crisis, call volume tends to go up. That's natural, right? That's human nature. And some of it is just because it's unknown, it's uncharted. So having some of these tools and technologies in place to really start aiding the interaction with our veteran community was really helpful. They developed, and I don't want to steal Charles's thunder because I hope he talks about these things. They developed a claims contention tool as well, which is used more on the benefit side. But it helps the veteran sort of interact and say, here's kind of the symptoms I'm feeling, and this AI component kind of works back and helps give an idea of what is going on with the veteran, so that it helps in articulating more in support of the claim that's going on, and work that was done in the DIML space. So all of these really were going on simultaneously and sometimes as a result of COVID. So how can we get more creative by using the technologies to help with the interaction? I also think some of these are laying the foundation for where we're taking our next level of strategy, right? There's strategic component, operational component, tactical level, but it feeds back into what changes for the next version of strategy. And a lot of that will be influenced by what's our customer base doing now as a result of COVID? How are they changing their business processes? And then what are those things that we need to accommodate for? So just a few examples, and I'm sure Charles will have many others.
Yeah, I think Drew Michael-Gard on the next panel may actually pull that thread a little bit as well. There's a couple questions coming in from the audience. I had one more myself, so I'm going to take the liberty to combine a couple since we only have 2 minutes left. They sort of fit together. In that you could never sort of prepare. I don't think any of us can prepare for any once in a century event, what we faced this year being one. If you could talk a little bit about just how senior leadership, and I know you all are, some of the most senior leaders within IT, but even more broadly, the leadership team as a whole, up and down the department, sort of how that enabled a comprehensive response. And I think you've both touched on it a little bit here. And Dom, you mentioned in the last question the thoughtfulness that goes into the execution of dollars. I think that's seen year in and year out, the tough decisions that have to be made in investments. But if you could just talk about that a little bit and sort of how that leadership and the relation to the enabling a larger move within the department. And, again, you did touch briefly on executing the fourth mission when called upon. But if there's any other ideas or thoughts that you had there, just want to kind of combine those questions and get your thoughts before we have to wrap up.
Yeah. Well, leadership is important, but it's the whole team. I gotta say, everybody really stepped up at all levels. Our leadership team was united, across our key pillars within OIT. But I'll also mention that our leadership teams across administrations and staff offices also came together. We worked very closely with VHA and VBA and cemeteries administration to make sure that their missions were kept on track. So the department took this seriously, and there was clear focus among the leaders to put any kind of disagreements aside, and that this was really an all hands on deck effort. We had to stick together. So that's what kind of unified us. It was about taking care of the veterans and, making sure that we in the Office of Information and Technology were taking care of our customers and getting the services out there when they were needed, where they were needed, and securely. So, yes, our leadership team stepped up, but so did, all of the OI&T staff and all of the staff at the VA. It was really something to see that team effort.
That's awesome. Hey, I think we're right up on the clock. I think there's no better place to leave it than that. And, really awesome to see the team working top to bottom, pulling the rope in the same direction. So, Dom, Susan, thank you so much for joining us. I'm sure the audience really gleaned a lot from the remarks, and, it'll set up to what's coming forward in the program. I think at this time, I'll turn it over to Ms. Megha Chokshi, who's our Senior Vice President on the VA account for GovernmentCIO, as she'll take us to the next panel of IT leaders. Thank you.
Thank you.
Thank you.
Thank you, Tim. Good morning, everyone. My name is Megha Chokshi, and I'm the Senior Vice President at GovernmentCIO. So today we have a very interesting follow-up panel to the discussion that Tim just had with Dom and Susan. It was very enlightening, and we are going to continue talking about IT modernization. So the way IT modernization has been transforming VA into a high-performing organization, especially in this times, and what we've noticed through this, through 2020, in terms of simplifying operations and providing access to high-quality care and benefits to veterans, we have a long path to go, but we are in a very good spot. And we have a very distinguished panel today to provide insights into the strategy and the innovation that is fueling VA's IT modernization today. So joining us today, we have Paul Brubaker, who serves as the Deputy CIO for the Account Management Office for VA's OIT. And in this role, he provides real-time strategic leadership to the IT team, the 3 VA administrations, as well as the VA staff offices, to best support VA's mission to our nation's veterans. Welcome to the panel, Paul. Drew Michaelgard leads VA's Demand Management Division, or DMD, which provides consolidated set of enterprise-wide IT services in support of the modernization effort. One can say that DMD is the gateway for IT initiatives, helping improve solution delivery, as well as providing better outcomes for the veterans. So welcome to the panel, Drew.
Thanks. Good morning.
Good morning. And then finally, we have Greg McDavid. He is the Director of Global Healthcare and Life Sciences at Salesforce. Greg is also a physician. He combines 10 plus years in healthcare with business, finance, strategy, and operations. So great mix of expertise and experience on our panel today. And I thank you all for making time this morning to be with us. We appreciate it.
Thanks, Megha.
Thank you. All righty. So one of the things that we also heard Dom and Susan mention is that The modernization at VA right now is really fueled by various concurrent initiatives that are running at an enterprise level. All of those implementations are going on in most cases seamlessly, and that is no mean task. And then at the same time, we're also partnering, access for innovative tools and technology through the Buy First program, which allows VA to focus on its core mission instead of really building single solution siloed IT system. So Paul, my first question is for you. Given the importance of modernizing IT products and services such that VA is able to provide the best-in-class service, best value, but at the same time, we need to balance it with the lights-on approach for legacy applications, which are also required, right, for the continuity of services. So in this instance, how is AMO and is AMO reviewing OIT's investment management strategy? What are the steps that your office has been taking?
Yeah, so that's a great question. Yeah, we are. The whole design is focused around, or the whole approach around IT investment management is to ensure that we can, sort of walk and chew gum at the same time, if you will. It's an issue related to ensuring that the sustainment budgets are met, that the requirements, to keep the lights on, which represents, 80 to 85% of most federal most federal agencies' IT budgets. We want to make sure that we've got complete full spectrum visibility into those budgets and that activity and those systems and those workflows and processes that we're enabling through that, as well as projects that we've got in flight aimed at modernization, aimed at achieving some of our strategic objectives as a department. And then we're looking at new starts, and we're doing this portfolio by portfolio. So, my office's job is to zero in and focus on that customer relationship management with our business partners to make sure that we understand their priorities, we understand their workflows, we understand how they're executing against mission, and we're applying the technology appropriately. And we're looking for opportunities to modernize and retire certain legacy applications and infrastructure and replace it with 21st century capability. Over.
Thank you, Paul. So Drew, you have played an integral role in supporting several high-profile initiatives at VA. And you have done it through the years, so you've kind of seen the progression as well. So from your perspective, what new products and IT investments have really shown the greatest improvements, both in terms of veterans care and also having a kind of a significant personal impact for the VA customers?
Yeah, great question, Megha. So and Dom, and this has been a theme, Dom brought this up about, one of our strategic priorities is customer service. And so we were able to deliver that through a number of channels. One of them is obviously online. VA.gov is a premier product for us. We also did it through some pretty immature earlier on communications through smartphones. Of course, people could call into one of our crisis line or one of our call centers. And the third one is they'd walk into facilities. With COVID, they were no longer able to just walk into one of our regional offices and file a claim. They were no longer able to come into a VA medical center and receive just walk-in stuff. It was emergent care only. So we focused on some key areas. One is expanding our telehealth. Previously, telehealth had been directed from within our facility where a specialist would reach out to another specialist in a consult. We flipped that model to where our physicians were dealing directly with veterans, so they didn't have to come in, especially for low acuity issues. We ensured that as regional office shut down or VSOs were not able to intake claims, that we were able to keep that. We were able to push out more advanced APIs and bring some of our back-end systems online that we'd always planned to build out, but accelerated that. Charles and his team really expanded the capabilities of our smartphone channel. So that text was mentioned, chatbotting. And then lastly, we really had to boost our logistics efforts. So the monitoring and movement of supplies around the nation as COVID ramped up in specific areas. So that was something that affected veterans directly and getting that PPE in the right spots or PME in the right spots, and then making sure that we had enough capabilities to serve their needs when they came in.
Great, thank you. So, Greg, we had been discussing this a little bit yesterday as well, that, modernization across the industry, not just within the federal space, but also in the private sector, has sometimes been a bit of a rocky road. Everyone starts in a certain place, and then it takes each organization takes a little bit of a time to find your sweet spot before you can move full force forward. One of the things you had mentioned is that organizations should not push IT modernization just to modernize. That's a very valid point. So can you kind of talk a little bit to that, and what is it that organizations, especially with lessons learned from the private sector, what is it that they should really be focusing on?
Well, I think that's a good question for everybody to work through, and it will be different depending on the organization that you're a part of, for sure. The VA is a very kind of purpose-built organization, and they go through this process pretty religiously, but all organizations should as well. And within healthcare, we see sometimes people pushing different IT adoption just to be the first one there, as opposed to having a strategic position around why we're doing it in the first place. So we make massive investments sometimes to not see a massive return on that investment, or even a significant benefit to our key stakeholders who are our patients. So some of the things to consider definitely before investing in any IT modernization effort is really what you're trying to accomplish. For most organizations, that's either reducing cost, operational cost, and improving efficiency, or on the other side, having a real impact on the way that our patients or members experience the care that's delivered. And that's probably the harder one. Both Drew and Paul mentioned customer relationships, and 10 years ago, that wasn't much of a conversation at all, and definitely wasn't a conversation in healthcare. And we don't think of patients as customers, and we don't think of their experience. We think of delivering high quality healthcare, which we do very well. But transitioning more to an experience model and the technology to support that is a challenge. So having a strategy about what you actually want to be and the experience you actually want to deliver is a key piece of information that I think everybody needs to define before they undergo any significant IT innovation in that space.
Great points, and I think this is a good segue really to talk about our COVID-19 response. So on March 30th, Secretary Wilkie had mentioned that VA was starting to execute its fourth mission, basically supporting the national COVID-19 response. He also mentioned in the same speech that while the fourth mission is important, veteran care is still the first mission. So Drew, this is my question to you. You've been very involved in the COVID-19, the pandemic response, VA's response. How, from your perspective, has all of this reshaped VA's priorities in terms of modernization projects, also, the delivery of services, such that we are addressing both the first and the fourth mission at the same time?
Yeah, great question. That's a lot to take on for any organization. Adding a mission in the middle of a crisis, but our employees dug in. They charged hard into it, and I think looking at the outcomes of those missions were great. Let's examine though from a IT perspective. We always wanted to go in certain directions, like paperless. We wanted veterans to use as little paper as possible. We wanted seamless and secure interoperability. So this just accelerated it. We've always wanted to enable our veterans to get the care where they need it, where it was best for them, most convenient. So our community care efforts, those are more robust. Now, what changed is we had previously pushed community care efforts to as fast as possible. And we hit a point for about 5 months where we wanted to delay anything that was non-emergent, but still keep that high touch and customer service with them, let them know we hadn't forgotten. So we had to retool our back-end systems to do the opposite of what we did before, which is to queue veterans up for care later and further in the future. One of the areas that we really are flexing into and think will shape it, the future is remote monitoring. We didn't expect, we saw a rise in Bluetooth capability or enabled devices around heart rates, blood pressure, scales, but the data had always been transmitted to us typically through like a notebook. You would bring in with you a notebook, and down you'd have your blood pressure information. We're working very hard to get that data in real time from our veterans, so they don't have to come in and relay that. Those are three areas that we have seen benefits in that we thought it would be 10 years down the road, and it turned into March, April, and May.
So, Greg, I'm going to pivot to you again for an industry perspective, right? So, when you look at how the private sector responded to the pandemic in terms of healthcare versus how VA also responded, there are some, differences. So, can you kind of highlight the key differences and what basically really sets apart what VA did compared to the private sector?
Yeah, I think that the VA was probably better prepared than most. For years now, the VA has put a large emphasis on remote capabilities. And you heard it mentioned on the last call as well. But their investment into both the hardware and the software infrastructure to take care of veterans at a distance is pretty substantial compared to almost any organization that you look at. So they were well prepared, more so than many in the private sector. And that is a global comparison. And that's not to say that everybody in the private sector was ill prepared, but the VA was very well prepared to stand up in this kind of environment where they were forced to adopt a digital first care model, which is not a typical practice for any healthcare organization. With that being said, that is a problem for most of the sector, most of the industry, that a digital first care model is not commonplace. It's not normal. It doesn't fit well into the clinical workflows of physicians or nurse practitioners or physician assistants. It's pretty difficult for us to implement that kind of widespread adoption across any large organization, let alone the industry. And we've seen that, when we first entered this kind of COVID period, the volume as a percentage of total visits that were attributed to virtual care was somewhere in the neighborhood of 5 to 10% for most organizations. And it was very limited in the types of services we were providing. It quickly jumped to over 50. In some cases, we were seeing 80 and 90% of visits being done remotely. But as we've seen kind of this tail end, hopefully, of this pandemic situation, it's dropped down substantially. The most recent report that was publicly released was from Mayo Clinic. They're back down to 25, which is a substantial increase still from the 5%, 10% that we started from, but nowhere near the 80, 90% that we were seeing. And so the challenge is going to be maintaining an environment and the capabilities as well as working it into our workflows to make it a user-friendly experience to maintain this digital first care model.
So in terms of, what I'm hearing everyone say is that, yes, veteran-facing self-service is very important, but at the same time, the underlying infrastructure is equally important to make sure those services are running. So we need to kind of strike that balance between veteran services, OIT's infrastructure, to ensure that operational efficiencies are there to stay and that they are also measurable. So we can go back and say how successful VA has been in providing, services to the veterans. So Paul, can you, from that perspective, can you share how your team has been reshaping the investment profiles for a more mission-focused delivery? How is all of this being measured? And do you anticipate any changes in the future?
Yeah, let me be clear, and I want to piggyback on something that Greg was saying, because I think it's important for everyone to understand that COVID really represented an accelerating event in terms of us executing our roadmap. So the digital first care model was actually part of our roadmap. If you go to the VA strategic plan, if you even look at the president's management agenda around the customer service goals, you would see that this is a priority for the department. And it, I earlier talked about our IT investment management strategy. That is all laser focused on how we apply technology to create measurable improvements in mission or operational performance. And those can be quantitative measures like savings, but also qualitative measures in terms of how well are we performing. Now, our whole approach around COVID was to make sure that we were laser focused on what the immediate needs were, but everything that we executed with respect to building out telehealth capacity, enabling fourth mission were all activities that were on our roadmap, and including things like being able to sense and respond to the hiring surge that we saw. And you heard Drew talk about the remote monitoring, the instrumentation. We accelerated that too, so we could see the health and well-being, particularly when it came to telemedicine, telehealth, tele-ICUs that we were enabling. And there were certainly a number of infrastructure implications, but infrastructure and applications go hand in hand. When we're looking at the applications that enable telehealth, we've got to make sure that they are riding on a 21st century infrastructure. So our whole goal around COVID was to make sure, one, we were staying ahead of the demand of the customer so that IT would never be a limiting factor on the ability to deliver quality care, and that we were able to accommodate this massive shift from in-person visits to televisits, telemedicine and telehealth that we experienced throughout the healthcare industry. And we weren't alone in that. And frankly, we had been anticipating a move in this direction and had been preparing for it and had a number of investments teed up and, to execute, as part of our investment management strategy going in. So all COVID did was really accelerate our focused deployment of the technologies that were already built into our roadmap. Megha, you're on mute.
Oops, sorry. So I'm going to piggyback on your response with a follow-up audience question. I think you answered some of it, but this is taking a slightly broader approach. So the audience member asks, VA OIT has taken bold steps to deliver increased value to veterans through accelerated delivery of applications. But will the turbulence of COVID, fire, hurricanes, and election cycle slow OIT's progress and focus on modernization as you're trying to balance a lot of competing priorities, to be honest?
No, not at all. And the reason for that is because resilience is built into the model and built into the roadmap. There's a certain amount of it looks like that we're getting a lot of stuff thrown at us. And I think we are, nobody predicted COVID, but in terms of the shift to telehealth and more telework, that was always on the roadmap. And, that emergency response mission has always been there and always something that we were planning for. And at the same time, we're continuing with a lot of our IT modernization initiatives around, EHRM, FMBT, Mission Act, Karma, DIMLs, all of those things continue in flight, and we're not really missing a beat with any of that. We're able to sense and respond because, frankly, I think we built a pretty good investment strategy, and it's just a matter of executing it and sticking to the script.
Okay, thank you. So Greg, I had a slightly different question for you over here. As we talk about health IT and infrastructure, the industry has been tackling the challenge a little bit differently, especially since there's been a push in health IT to move from CapEx to OpEx. So given those push, as well as, internally, Drew, to you, VA has also been pushing to move away from the CapEx to maybe an OpEx model. How has this impacted your division's roadmap? And Greg, to you, how has this impacted your company's push towards more of a focus on actual value rather than something that would be created out in the future?
Yeah, so I'll go first, Greg, and then defer to you. So one of the key areas that we've looked at are how do we bring SaaS in that's more secure, faster, and plug those into our enterprise APIs that are going to allow that data sharing. Another key area that we're looking at is definitely getting away from the building. It takes us too long within the VA. So look at frameworks, like for our chatbot solution, we used a pre-existing commercial framework that accomplished at least 80% of our requirements, and then just move forward with those frameworks. Get that 80% solution and moving out. The last thing is as we move to this leveraging the cloud and some of our key investments there, be able to horizontally scale out our backend databases and our applications as we need. So we can't build data centers to predict crises like this without busting our budget. So how do we build our applications correctly and then leverage the cloud appropriately to do that scaling, to deliver that value in the real time and the necessary uptime of applications that our customers expect? Greg?
Yeah, thanks, Drew. Meg, I think Paul mentioned it the best, and it's the same for us in the private sector, is the direction that we were headed and continue to be headed really hasn't changed in terms of our overall investment and strategy in healthcare and life sciences. For years now, we've been moving toward this more virtual model, and we've been expecting it, but it's been slow. What we've seen in the private sector is the same that Paul mentioned in the VA, is a dramatic acceleration into that space. So globally, in all regions of the world, whether you're talking here in North America or you're looking at the EMEA region or Asia Pacific, everyone has taken the digital first operations model from a nice to have or a roadmap to a necessity almost overnight. And they've pulled forward those budgets, and they've dropped other initiatives in order to put this in place. Some of that has been because of necessity to stay in business for some of these organizations. We saw a huge shift in our ability to provide services, whether you're talking a healthcare provider in the truest sense, or kind of this mixed provider payer systems that are out there in the public sector as well, that are a little bit more comparable to the VA model. But all of them have pulled that forward and realized that they had to have it. We've been in conversations, though, with these organizations for years now, and it's all been on most of their roadmaps to adopt these kind of operating models. And like you said, shifting from CapEx to OpEx. And the most significant shift that we've seen both in the industry and as well as our ability to support it is back to that real impact on the patient outcomes. We've put a lot of emphasis on internal administrative efficiencies, which is always important. And as Drew just mentioned, we are always conscious of budgets. And that just impacts our ability to go through this innovation cycle. But the biggest shift is around actual patient experience and outcomes. And we have, we've adopted that mentality, and we've seen most of our customers in the private sector start to adopt that mentality as well.
Great, thank you. So we have about maybe a minute to wrap up. So a quick roundtable. As we focus on 2020 and the way things have been completely reshaped, how do you view, Paul, from your perspective, Has the pandemic kind of highlighted what IT resources are best to invest in?
I'll take that just real quickly because I also want to say thanks. I don't know that it's had a fundamental shift. I mean, the priorities have been kind of remain the same, but we reshuffled them a little bit just to address the pandemic. But we continued, kind of business as usual. But I will say this: our ability to stay ahead of demand, make sure that the equipment was getting where it needed to be, when it needed to be there. And just it required a full-time, round-the-clock, 7-day-a-week effort through the height of that pandemic. And we could not have done it without all of the pillars within OIT working together. But more importantly, our private sector partners really stepped up to the plate. I mean, all of our suppliers made themselves accessible. We were able to modify some contracts. We were able to do some of the mechanical and administrative things we were able to do to stay ahead of that demand and address that surge in requirements and capability that we needed to deploy. And I got to tell you, we busted some typical operational models. We had to, in the middle of the pandemic, we had a hospital donated to us down in Garland, Texas, and we had to get it up and running. We had 2 weeks to do it. And all of our partners made sure that we got the circuits and we got the hospital wired up and converted into a VA facility in 13 days, which is unheard of. Normally those circuits take 90 days plus to get provisioned, and just the way our business partners stepped up to the plate was unprecedented. I've never seen anything like it in my few decades in government here, and it was a beautiful thing to see. Over.
Thank you, Paul. So Drew, from your angle, are there any products that you believe are going to be around long term, maybe permanent components of VA services going forward?
Yeah, absolutely. The telehealth, and to Paul's point, like we scaled telehealth from the background. I don't think people are going to go back to wanting to go into their physician or into a hospital unless they have to. So that's going to be a big one for us. We also really feel like our efforts in the chatbots, but also like the smart routing between our call centers. I didn't talk much about it, but making sure that your answer that a veteran's answer gets answered as quick as possible those will definitely carry over, as well as the rest. I think this fundamentally changed the way people work in telehealth or in remote working. So I don't think we'll see a lot of these changes. It was just the future coming earlier.
Perfect. And Greg, any last thoughts on your end? How do you think VA is positioned in comparison to the private sector going forward?
Yeah, overall, especially in that digital space, I think VA is probably one of the leaders. They've been quick to adopt that kind of mentality historically from Vista when they built their own electronic health record system, really ahead of the curve. And we're seeing that more in the telehealth space as well. One thing that I think will stick around or we'll see an innovation in is the AI into this space. Drew mentioned it, the chatbots. Right now, their sophistication is limited in terms of their clinical adoption or clinical capabilities. But I think we'll see more and more of that as we go forward and see this shift to a digital first operating model, to a clinical model, and get these chatbots and artificial intelligence to start screening patients and go through kind of this digital triage process to really handle the volume and be able to scale these kind of operations, because that's one of our challenges is scaling instead of just replicating, but truly scaling these digital capabilities. And I think that will stick around as well. One of the things we're going to need to support it, of course, is change in our national position in healthcare. The payment models that we all face in terms of reimbursement have to shift to support that model going forward, but I think they will. And we're seeing it now discussed, on the Hill. But I think that we'll see that because, like Drew said, patients aren't going to want to go back for the most part, as much as they don't have to.
Thank you. And yes, I agree. There has been a fundamental shift. And I actually look forward to maybe catching up with the three of you all maybe 6 months from now and touching base to see how how much better we have even moved from where we are today to, the next phase. So we are rapidly running out of time. So thank you all. We sincerely appreciate your continued efforts at VA and, as partners as we work to transform how we serve veterans. And at this time, I would like to hand over our next panel, Demand for Digital, to my colleague, Andy Andrews. Thank you again.
Thanks, Megan.
Thanks, Mega. I'm Andy Andrews, a director with GovernmentCIO, supporting the VA and focusing on digital services and improving the veteran experience through practices like human-centered design. I'll be moderating today's panel, Demand for Digital, where we will discuss some of the new programs designed to improve digital services and the veteran experience at VA. Today, I'm joined by three innovators who have decades of leadership experience at VA. LaWanda Jones, Deputy CIO of the Office of Strategic Sourcing, U.S. Department of Veteran Affairs. Barbara Morton, Deputy Chief Veterans Experience Officer, U.S. Department of Veterans Affairs. And Susan McHugh-Pauley, Senior Strategic Advisor at Worldwide Technology. Panelists, if you could please take the opportunity to introduce yourself, talk a little bit about what you do and some of the ways that you work towards enabling digital services at VA. LaWanda, can you please begin?
Absolutely. And thank you all so much for giving me the opportunity to speak today. My role in the VA in OINT as the Deputy Chief Information Officer for the Office of Strategic Sourcing, it's my responsibility to ensure that from a procurement and acquisition perspective, that we're looking at our actions from a strategic perspective. We're capitalizing on opportunities. We're looking at how we can use technology to further our products and services. And I know that you all have heard all of the great things that we've implemented during COVID, and all of that takes a contract and acquisition to do so. And we have to do that expeditiously, as well as following all of the like the Federal IT Acquisition Technology Reform Act, known as FATARA, and working with our supplier community and so on and so forth. So it really does take a team effort to be able to execute on our business.
Barbara?
Thanks so much, Andy, and it's great to be on this panel with LaWanda and Susan. Really appreciate the opportunity. So as you mentioned, I am VA's Deputy Chief Veterans Experience Officer, and it's a pleasure for me to work with my IT colleagues to enhance the experience in the digital space. So as we know, veterans, their families, caregivers, and survivors are always kind of looking for a digital front door, and we want to ensure that we're infusing the voice of the veteran using human-centered design practices, as you mentioned, Andy, and as prior panelists have mentioned as well, to make sure that we're making enhancements that actually meet the needs that veterans tell us that they want, rather than us sort of trying to think of the right solutions for them. So it's been a tremendous partnership over many, many years with IT, LaWanda, and Susan previously when she was at VA as well. We'll talk a little bit about va.gov and sort of the Veterans Experience Office's role in that transformational change initiative that has actually produced tangible improvements and better results for veterans. Over, thanks.
And Susan, please.
Good morning, this is Susan McHugh-Pauley. I am the Senior Strategic Advisor at Worldwide Technology, Public Sector, and I'm thrilled to be at Worldwide. I have 31 years of government service, and I had the pleasure of working with both LaWanda and Barbara through various opportunities at VA, and I retired after 31 years as a Deputy Assistant Secretary of IT Operations and Services. So, VA is very near and dear to me, and working to support both of these ladies and all of VA efforts is, definitely something near and dear to my heart and what we definitely want to achieve here. So looking forward to today's discussion.
Definitely. Thank you all. And Barbara, I think that's a great starting point. That, the va.gov modernization effort is a tremendous success story across all of government. Can you tell us a little bit about how that came to be, and what's the next va.gov that we can expect to see in the VA's digital transformation roadmap, geared towards improving that veterans experience?
Yeah, absolutely. So again, the partnership between my office, Veterans Experience Office, and IT is really based on a shared meeting of the minds and how important experience is to deliver to the customer based on kind of what makes sense to them, what's most important to them. So a little bit of background on how we got to what today is the new va.gov. So there was a discussion a number of years ago about the need from veterans to have sort of a single front door, a digital front door to kind of enter VA. They tell us, hey, we're not really sure which website to go to. We would love to have sort of a single front door. So as you probably know, there are a lot of VA properties, web properties out there. And so what we did is we applied the best practice of human-centered design, went out, talked to veterans and said, hey, if you're seeking a front door to enter VA digitally, what type of web property do you look to? Is it eBenefits? Is it vets.gov? Is it va.gov? Is it My Healthy Vet? There are any number of properties. And the feedback that came to us is that they oriented towards va.gov. And so we knew that that was a very strong brand to be this sort of front door with transactions with VA for veterans and their families. So that was sort of decision point one, again, based on the voice of the customer, based on what they told us. Decision point two was, how do you sort of revamp the website so it doesn't look, super bureaucratic and kind of, just not engaging for a user? And so again, working very closely with OI&T, applying human-centered design, we prototyped and tested the new design that we have today with veterans and used veteran insights and data to put transactions that they wanted right up front, most frequently used right up front. So it's a website that actually works for them and enables them to have seamless transactions with VA. And I love to cite this data point. I know I've talked about it before, but in the year after we relaunched va.gov, veteran satisfaction with the website increased by 9%. I mean, that is really transformational. And I always say, proof positive that when you actually lead with experience and lead with the customer needs, you're always going to produce better results for them. So it's a great success story. And I think we'll continue to use those human-centered design processes and elements to continually improve and update va.gov in the future as well.
Yeah, I think that's so important to use those design principles. I mean, what good is technology or government services and benefits if it's not easy to use? And I think that brings us to another good point as we see more and more of the consumerization of technology. Today with just a few swipes, it's very easy to use and intuitive and user friendly. You can pay bills, you can check your bank account, you can check your retirement accounts, you can pull up medical records all within the span of a couple minutes, even notes from your doctor, all going back and forth. All very intuitive and user-centric applications. Is that a reasonable expectation for government services? And where are we in that journey, and what are some of the main obstacles we need to overcome in order to achieve a more seamless user experience?
Yeah, I mean, I'll take that and certainly chime in, LaWanda and Susan. But I mean, I think it's really
I'd like to hear from all three.
Yeah, it's really about a meeting of the minds, I think, in terms of, we in VEO and in IT are in total lockstep in terms of our thinking around modernization and applying those human-centered design principles. And what we see in industry is really kind of a reaction to industry knowing what the user needs and wants, or else they might go out of business. So being rapidly responsive to that. Is it realistic for VA and other agencies to get there? Absolutely. And that's frankly the expectation. And with the help of IT and the partnership there, that's exactly the direction that we're moving.
Yeah, and especially, as a veteran myself and a user of the capabilities that we deliver, and as we look at even our workforce, newer generations, younger generations coming in, we in the federal government, VA and other agencies, we have to keep up with technology. We have to have those innovative ideas and innovative capabilities and services. However, we have to make sure that from a security perspective that it's built in. We cannot allow just anything to be downloaded on our networks. So we have to be extremely vigilant, yet understanding that we need to provide the proven, secure state of technology. You know, when we look at, listen, this meeting here, we even when Teams, we rolled out Microsoft Teams as we were in the throes of COVID. When you heard other guest speakers talk about our increase in our telehealth capacity, our telework capacity, my smartphone. I want my government smartphone to be like the one I can go to the store today to buy. So we have to stay attuned with the state of the art technology, building those human-centered design technologies into it up front and early. So what Drew Michaelgard may have talked about, our APIs, API architecture, just like I download an API on my personal phone, I have to be able to do that with in my government capability. The veterans demand it. Our taxpayers demand it. We just got to be smarter in doing it.
Yeah, and I would add on to both of you that, industry is definitely here to assist and to provide the unlimited support to the transformation of VA, right? I mean, within Worldwide, we have our digital platform and labs. Various other vendors have all types of technologies to assist, right? As you buy versus build, how can we help to make sure that if we're going to fail, we fail quick, we fail in an environment that won't impact the veterans, right? But we can all be successful to make sure that their experience is seamless. We can learn together and really get to those outcomes that are successful for everyone, especially the veterans first.
Yep.
Yeah, and Susan, to your point, I mean, just talking about partnerships, and LaWanda, what you said, every transformation initiative we do requires some partnership, whether it's contracting or other assets throughout government. And so I think, again, having this community that is really focused on delivering on experience, we're all pushing in the same direction together, whether you're inside of government or outside as well.
Yeah, and especially given this particular instance that we're in today, a black swan event of our lifetime, and how from a government industry partnership, it's key. It is imperative because we're all competing for the same technology worldwide, globally. So that it's important to have those vendor relationships and understanding the ecosystem, the vendor ecosystem.
Right. And as VA has transformed and grown, right, especially through their strategy of, looking at IT modernization and the business transformation, now that with COVID and everyone running as fast as they could right now, how does VA and industry help you really kind of pause and optimize and utilize all the data that you're collecting to really add value and bring back the successful outcomes that will help the veterans, as well as making sure that the employees and the data that you're getting, right? It's like the, hottest currency but really utilizing that data to add value, right? So that's where I think that there's great partnerships and, that industry is really here to assist in that journey as VA continues to grow and modernize.
Yeah, I think a lot of really good points there I'd like to touch on. We could probably talk about this for days, but Luana, you brought up a great point, this Black Swan event that's affecting all of us so deeply, VA and veterans especially. What are some of the new, digital capabilities and applications that, exist or are coming to fruition as a result of COVID? How have you partnered with the vendor community during this time?
So, I knew in my office, we serve as the front door to the vendor IT vendor market. So we knew that we had to understand, one, our strategic capabilities that we needed. And based upon those strategic capabilities, that there's a strategic vendor that's providing those capabilities. So we partnered with our vendors, and I'm sure Maheen from Dell, who was on previously, talked about the relationship that we had. I can tell you that we had conversations with our vendor partners on Saturdays, on Sundays, 24/7 on speed dial, because we had to understand the supply challenges. Paul Brubaker talked about how we had weeks to get a new facility up. We could not do that without innovative acquisitions, without having the partnering and the relationships with those vendors that delivered those capabilities. So out of the gate, we had to have those strategic partnerships, and we had to have those partnerships at the top level. I think I talked about chatbot, we talked about vet techs, everything that we have delivered, whether it was increased capacity, whether it was doing more telehealth visits, more telework, we needed end user devices, and we needed those right away. In order to do that, you have to partner with the suppliers, and understanding the supply chain was critical.
I would add to that too, Lawanda, right, is to further earlier discussions with Dom, and that is really on the, storage optimization. NetApp has done a great job with all the cloud, and really VA has positioned all along with all the planning that was done. Now there's, other avenues that, again, to optimize what they've done, right? You just awarded that Spot acquisition, and, what can be done with the data that goes from there. And there's a lot of things with, Cisco and the Flex agreement. Your office has really, knocked it out of the park with what's been done with consolidation of the voice and the call centers. And then the next step, now that, you don't have the airplane running as fast as it can, it's kind of landing, and we can optimize, what we've got with that data and pick a direction, and how industry can help, support you in that, and really test drive it, with the labs that are ATC and, other vendors that are just willing to and passionate about the mission, want to step up and provide that support to VA and continue with its transformation.
Absolutely. And they all stepped up. I mean, we, again, I would be remiss, and I know I would miss someone's name if I were to outline just everybody. We during the COVID outbreak, between, I would say, a 30-day period, 60-day period, we saw over 125 vendors, 125. We normally do about 200 vendor visits a year, but we have just surpassed that tremendously. And it's because of partnering. It's because of getting those on-the-spot capabilities, but doing it smartly.
Right.
Yeah, Luana, it's been so impressive to see, to your point, the all hands on deck mentality at VA between, leadership and the workforce. I mean, really everyone has been burning the candle on both ends in these, kind of unprecedented and trying times. So that the response has been incredible. Turning gears just a little bit, Susan, I think you bring a really interesting perspective given your role as the former head of ITOPS, VA's Infrastructure Operations and Services Group. How is the VA's infrastructure built to accommodate and enable these new digital capabilities, and even a pandemic like COVID and the associated increase in telehealth and remote work, and the chatbot that we're mentioning as well?
Well, I would say, for me, and being in operations, VA infrastructure is its most valued asset. Without that foundation being really sound and secure to make sure that, you can have a seamless experience, that, the clinicians are getting information timely to provide the services that are required. It's really a holistic approach. The technical debt that VA has, but people forget it's just not technical debt, it's the facilities that some of them are majority of them really are much older than 40, 50 years old. So working on that continual investment into the technology debt, I mean, COVID has done incredible with, that effort and really to stand up what they've done. I'm going to call it TeleX, right? Because it was health, conferencing, numerous things that went on for benefits and all of the services that were provided by VA. But now really looking at the investment that was put in there, but how do you really optimize that and continue with that supply chain life cycle management to continue really the block and tackling and not losing that foundation, but growing it smartly. And I know Luanda and strategic sourcing, I know she's been working towards standing up an industry advisory committee and working towards a lot of things to really show up differently that industry can help with. But, doing that, that's the way of creativity, so that the veterans experience does have that. Strategic sourcing can get the right solution and really assist in, making that seamless path to, bringing in what the VA needs. So the infrastructure to me is key. It's absolutely key. And looking at testing because of the aging infrastructure, but all of the components and what's really the best value. Collecting that data with all of the tools that the VA has now, getting that data and really optimizing the path forward and what do we do to support the efforts underway, such as the EHR rollout and various other, things that VA is working towards.
If I can just comment on something that Susan said that really resonated with me. So, we're talking a lot about in longitude partnerships, right? Industry partnerships inside of VA. And there are other programs out there that we've been leveraging, IT specifically. So the United States Digital Services team, Charles Worthington, kind of came from that team, and he's bringing in folks who are industry leaders, and they are super smart, coders, and they have all this technology background. And what a great strategy that IT is leveraging to bring in these folks and start to build this capability in addition to leveraging outside help inside as well. And again, I think that is such a best practice, honestly, and really a reason how we've been able to make such great progress.
Yeah, you're absolutely right, Barbara. And also with Charles, team and what VA, where it really has branched to, is supporting a lot of state and local, as well as other federal agencies, right? Working closely with HHS or Indian Health Services to get that to the rural areas. And how does, that team really assist in that? I mean, there's just a lot that industry can bring and, really in those partnerships, to your point. I mean, the talent from Charles's team and all that's going on with Drew's team, I mean, it's just incredible on the path forward for VA.
Yeah, it really goes to show that it takes a team effort from the government, from industry, and I mean throughout the government, throughout when we're in a pandemic state, it takes our acquisition professionals, both not only in our department, but in GSA, at OMB. So it really takes a consolidated effort to do what we did in COVID. And to, like Susan said, optimize it. Optimization is the key. Being able to put the strategies in place that are scalable. We can scale up or we can scale down, but we've got to do it rapidly.
Right. And as well as Luanda embracing that fourth mission, right? I mean, going out, to everything that VA has really got its, I want to say tentacles or hands onto. I mean, it's just the reach of what the VA and the services that they provide is just incredible.
And I would say that, when we started really talking during COVID to our industry partners, there are folks that didn't understand our fourth mission, but not only industry, but internally in our home, in our house. So our VA mission is huge on a normal day. And it expands during a pandemic, a flood, a hurricane. We are there to serve the public. So Andy, Susan, it may have been your cousin, maybe a veteran who received capabilities from us, but also someone who is not a veteran during a pandemic such as this. And when we exercise that fourth mission, we're seeing healthcare and benefit throughout the public sector.
Yeah, I think that fourth mission is so big. But to your point, everyone I know who works with VA has veterans in their lives somehow, whether it's family, friends, themselves. So that mission is so important. And going back to the demand for digital, I think one of the biggest challenges in digitization, whether it's government or the private sector, is talent. Barbara, you mentioned the influx of talent we're seeing from some of the top technology firms in the world who say they support the mission. They want to help VA embrace digital services and these new emerging technologies. But what are some of the ways that VA specifically is overcoming that those talent challenges and attracting and retaining some of the top young tech talent?
Yeah, I mean, I think that's it's a strategic opportunity, I think, for VA and frankly other agencies to really dial into, right? I mean, we all hear we're going to have lots of retirements in federal government. How do we make sure we bring in, sort of younger generations to stay and to sort of bring their vision and their talent into government? I think from where I sit, one perspective is in my office using sort of different types of methodologies like human-centered design. It really energizes people because you get so close to the customer and you get really rooted and grounded in mission again. So it's really not just about going about a transaction in a day-to-day. It's about being very emotionally connected to the mission and the customer. And so I think the approach that my office takes, the approach that Lawanda and IT and team and Susan take in terms of making sure experience is up close and personal to how we're actually understanding problem sets and actually how we're solving them, I think is a real pull. It's like a gravitational pull for folks to get really, really drenched in understanding the customer and adapting government to serve the public first and foremost, rather than serving the transaction or the bureaucracy first.
And also just one added thing from an acquisition perspective, doing business differently, having more demonstrations as opposed to just the paper solicitations, pretty much a show me, don't tell me, because anyone can be a creative writer. Just having more innovative in the procurement process. And, we're working with our acquisition colleagues just to do that, doing more sampling of our performance work statements where you come in and you tell us what you've done in a like complexity or a like scope, as opposed to writing a dissertation.
Yeah, I couldn't agree more. We're getting pinged on time, but I do want to allow one or two audience questions. I've got them live here. This is one coming in from the audience. How are you working to better improve the digital experience for the GI Bill?
So I can take that. So we're working with Dr. Lawrence and his team in the benefits administration to take a look at how we can use software as a service so that we can provide better capabilities in regards to the GI Bill. And, again, I said, I'm a veteran and I have that same GI Bill. So I have an interest, a vested personal interest to modernize and be able to use technology to go on and see what benefits do I have left in education. I want to further and get my another degree. So I need to use that digital capability to even access my benefits. I know that's being selfish, but from a veteran, that's what veterans are talking about. And so we are working with VBA to see how we can modernize our benefits platform and the capabilities that we're doing in that space.
Well, thank you all so much. If it were up to me, we'd continue for a couple more hours, but unfortunately it's not, and we've run over time a little bit, but thank you all so much. It's such an honor to speak with you all today and very much appreciate your perspectives. I think these are such important issues for VA, for veterans, for taxpayers, the government, and our country in general. So we really appreciate all of your work. I'm going to hand things over to GovernmentCIO Media and Research President Mike Hoffman. He's with Ranking Congressman Phil Rowe. Thank you.
Thank you.
All right. Thank you so much. Thank you, Andy, for the introduction. All right. Well, I am honored to close this morning's program with Ranking Member of the House Committee on Veterans Affairs, Phil Rowe. Ranking Member Rowe has served 6 terms in Congress and represents the 1st District of Tennessee. He served as the chairman of the committee in the 115th Congress. So we're really excited to have him. Before joining Congress, the ranking member served as a doctor, and notably after receiving his medical degree from the University of Tennessee, he served 2 years in the U.S. Army Medical Corps. Congressman Rowe, thank you so much for joining me this morning.
Thanks. Glad to be here. It's been interesting listening to the conversation about technology.
Absolutely. Well, we're really excited to have you for all the reasons I mentioned in the introduction, especially with your background with healthcare. And I got to imagine it's been really interesting from your perspective to see how this has transpired, throughout these past months in working there. So I guess I wanted to start a little bit of how I started with Chairman Takano, and I wanted to just start and see what your impressions were about the Department of Veterans Affairs response to this pandemic and how they're supporting veterans.
No, it's a great question. And I heard the previous panel talking about the 4th mission, which most people don't know about, and probably many people inside the VA. And the VA began back in January. Really, we only sequenced this virus in January. We didn't know there was human-to-human transfer of coronavirus. It's until mid-January when the WHO recognized that it was, and from the time the sequencing of that virus, Dr. Stone, Dr. Wilkie, Dr. Lawrence, other leaders at the VA put the 4th mission into play. And as was mentioned by our previous panel, it usually is for natural disasters, for earthquakes or floods, tornadoes, whatever it might be. But in this case, it turned out to be a pandemic. And I really want to give the VA a shout out with this. I think they have been incredibly helpful. And we found out, and we've literally learned, Michael, exponentially over the last 8 months about this virus, 7.5 months. I've been around, I graduated from medical school this December, 50 years ago. So I have seen a lot of changes in medicine during that time, but I don't think I've ever seen a response where we went from a disease that we knew was of viral origin to reducing the mortality by 40% in 7 months. I mean, that's unheard of. And one of the things the VA did, which was incredibly helpful, was to take their expertise into the field of fire where the real damage was being done, which was our long-term care facilities and our nursing homes across the country. We know that over 40% of the deaths occurred there. So they dispatched their nurses, their personnel, along with PPEs and training, really training. We got the PPEs up pretty quickly, but the training where if you're in a nursing home, how you don't spread the disease from one area to the other. And I think that was probably one of the most helpful things they did and are continuing to do.
Okay, great. One of the things that you've really focused on is, during your time in Congress, and especially most recently, is electronic health records. Can you talk a little bit about, the importance of that and how that's really allowed, the Department of Veterans Affairs to pivot during this crucial time?
Yeah, it's look, I go back to where I remember our first, we computerized our office charge for 4 of us, our billing. It was a huge computer that was bigger than my desk I'm sitting behind right here now and was out of date in 18 months. And technology was going from a rotary phone to a dial punch phone. We've gone from that to the electronic health record. I had the experience of putting an electronic health record in my own office. And we had, 80,000 charts. And I realized how big of an undertaking that was just for one single office. So I knew that this undertaking at the VA, when you're talking about millions of records across 170 medical centers, almost 1,000 CBOCs, that is an enormous undertaking. And so in the last Congress, I actually ran again because I wanted, and the pandemic sort of kneecapped us on this, but was to really sort of help get this off the ground and going because I understood how critically important for patient care this actually is. I've visited many centers around the country. I've been in Spokane several times. I was in Seattle where they're rolling it out, and they started rolling it out in the Northwest as DOD had already done. And it became obvious to me that we need a lifetime virtual electronic health record. From the time a young recruit goes in at 18 years of age and then transitions to the VA, and then, as Vietnam's been over almost 50 years. So that time has gone by. And think about the treasure trove of information you could have if you had an electronic record on all of us at the end of Vietnam. Right now, you wouldn't have had any questions about Blue Water Navy or Agent Orange. You could have mined those records and found out. Right now, think about burn pits. Going forward, and look, we haven't had our last war, unfortunately, and last engagement of our military. You take a young recruit now, put them in that system, and then when they're my age, you'll be able to look at that and find out, yeah, this was something that their service did, or no, it was not. So I think it's critically important. And one of the things, and it was mentioned earlier, I think, if anything good came out of the pandemic, the transition to telehealth was one of them. Both not only at the VA, but in the private sector. Literally in my own medical practice, it helped keep us afloat where we could see our patients, take care of our patients, and keep our practices open. And the VA has done exactly that, which is, I think, a very good thing. And I mentioned, and I'll have these numbers wrong, but just in mental telehealth visits, they went from thousands to hundreds of thousands of those, which was a good thing because the patients didn't get disconnected. One of the bad parts about COVID is it's isolated us. Here we are right now. We'd do this in person if it were not for COVID. And patients are sitting home. Many folks are alone and despondent. And this is a way to connect and keep their care going.
Yeah, and you made a point a little bit earlier today when we were talking about how a lot of the telehealth appointments were being applied in Afghanistan already, when a lot of soldiers were receiving concussions. And it's been, not great, but it's been, really helpful to apply a lot of those technologies during the past few months to help veterans. From your perspective, as a doctor, how is that actually providing potentially more care to veterans? Potentially removing the roadblocks of that 4 or 5 hour drive to the VA hospital and being able to maybe get more care and more interaction with a doctor by being able to normalize these telehealth appointments in a new way.
Yeah, one of the things we put in the Mission Act was the infrastructure review part. And the reason that's important is our veterans are moving. They're moving from the north and east to the south and west. And so you want to have your facilities where they are. Well, one of the things that telehealth allows you to do is to do just that. It allows you to have the facility wherever the veteran may be. So I think it has huge advantages, and it does another couple of things. Where you have specialty care, where you may have to travel miles. We're talking offline about when I was out in Oregon and found out that the district I was in was actually, that one congressional district was larger than the state of Tennessee. And it hit me when I was there. I thought, well, I've got to help write a bill that if a veteran drives 5 hours and their doctor's tied up in the operating room, can't get out, whatever, they've just wasted an entire day. And the VA spent money paying them per diem to get them down there and back. It made no sense. What this is going to do, I think, is going to enhance the Mission Act, the increase of telehealth. It'll allow the VA doctor to have that visit with a patient that may be miles and miles and hours away. In this case, a pandemic. One of the things that worried me about the pandemic, and we will learn from this, and we'll have an after action report, is delay of healthcare, because I saw it happen. Mm-hmm. When the pandemic was at its maximum back in March, April, and May, in many places, patients didn't come in, and so their care got delayed. I think we'll learn from that and be able to, as we position both in the private sector and the VA, to provide that care via telehealth if we run across anything like, it could be a hurricane, it could be some other natural fires, for instance, that are going on now in California, where maybe a patient needs to be checked, and you'll be able to do that via telehealth.
Okay. One of the issues that you were focused on at the outset in March and February was the GI Bill and what the payments might be to veterans with the changes at the different universities and colleges across the country. How has that evolved over the past few months, and where do you see that going as this continues and these colleges and universities try to figure out the best way forward?
Well, that's a great question, because you're absolutely right. Our higher education system is trying to figure it out right now, and they haven't. Do you bring the student on campus and let them sit in a dorm room and take a virtual class, or do they stay at home? What do you charge them? I do want to give a big shout out about the GI Bill. 1975, I separated in December of 74. I was able to use the GI Bill. It paid me $300 a month for 2 years, and it lasted for 10. I could only use 2 of my years. But I'm appreciative to this day for that $300 a month. I had a young family, and it really helped me. So I never forgot that. And when I got to Congress, I thought that helped change America. We know that the GI Bill after World War II really helped change this country, educate a lot of young men and some women, but mainly young men at that time. And when I had the opportunity, and I want to give John Clark, who's on my staff, a huge shout out. He has been an incredible proponent of this. And we figured a way that how could we make the GI Bill, which the post-9/11 GI Bill is a phenomenal benefit, as you know, with per diem, tuition, and so forth. But how could we make that lifetime? Because this is a perfect example of why we did it. You may have to retrain. Your job may have gone away forever now, if with this, many have. So if you have access to the GI Bill and can use it at 50 years old, you may work another 20 years. And certainly with technology, we're seeing that people are now able to work at home. And this pandemic will change a lot of how our businesses operate. And we want to educate our veterans, who are some of the best people in the workforce, without a doubt.
Yeah, I think that's a perfect transition to the next question I was going to ask around unemployment and some of the challenges the veteran community are facing right now. With training, GI Bill, and what are some of the other ways that Congress and the VA can support some of those veterans who might be at home and looking for different ways to add those skills?
Well, I think one of the bills we've got, 7111, and I really, and Leader McCarthy, our leader on our side of the aisle, has really proposed this for STEM. We know that the technology part is going to, it's not going to go away. It's only going to increase. every factory I go into is now a technological marvel. It's no longer just a guy or a gal beating on something. These are very sophisticated manufacturing plants now. I've been in them all over my district, and I marvel at the robotics and all the other things that make it more efficient and more productive. So we've got a bill out there that hopefully will get signed into law that allows, and I really like this because we put an apple and a stick. Said, okay, you get the place gets a third of their tuition on the start. You then get a third when they finish, and then you get a third if they actually get a job in what you supposedly trained them to do. Yeah. So I really like that, and everybody has, everybody, the veteran, the school, and the taxpayer all are in this arm in arm. So that's one of the little things that we put in the bill that I think will help. But training in STEM certainly I think is at least a major objective of mine, to make sure that these young people have the skills, and then we get to training, because they are great employees. And fortunately, even during this pandemic, our veterans unemployment is lower than still too high. Women a little higher than the men veterans, but better than the population in general.
Okay. I think we're running a little bit low on time, but I wanted to, for a final question was, what are some of the long-term impacts you're seeing? We mentioned telehealth and how that's normalized, and really, the transformation that the VA has undergone in months, which, oftentimes takes years. What are some of the other long-term impacts that you see for the veteran community as this continues and, as this pandemic continues to evolve?
Well, we will come out of this different, but the new normal won't be everybody, wearing a mask, and we're going to have a normal again. I can tell you that. But it will look different. And look, I look at large, big cities with these huge skyscrapers and very expensive space. People have found out, hey, I can be just as productive at home or in my car. Today I was on a meeting earlier. They were at the car dealership getting their oil changed, and we had a perfectly productive conversation. So I think those things will change. Some of those will stay permanent. And I think a veteran is no different than anybody else. And they just have some extra tools because of service to the country, which we are providing for them, both in education and in disability benefits. And I also want to say Dr. Lawrence at the benefits side has done a great job of reducing the backlog of these disability claims. When I came to Congress in 2009, was sworn in, there were 1 million. I couldn't believe it. 1 million backlog disability claims. It was astonishing to me. And that number, he was trying, not the appeals I'm talking about, but the initial claim, 120 or 125 days. He was going to have that at 0 by July the 4th. That was his goal. Obviously, the pandemic slowed it up because we couldn't get the exams done. But I think that's a very positive, and I think the technology changed there. The other thing about technology I want to mention before I get off here, it can be the most frustrating thing in the world when it doesn't work, and it can be the smoothest, nicest thing when it does. And I've been on both sides, and I know we had one of the senators had a few choice words to say that wasn't filtered. He didn't have his mute button on when he was doing one of these virtual hearings the other day. I feel his pain. I understand exactly his frustration. So we need to get it more user-friendly, easier for people to access. And I know that we mentioned the GI Bill benefits. I think they're doing that. They're either starting or in the process of completely redoing that experience for veterans so that their payments get there on time, the school's not hounding them, that kind of thing.
Excellent. Well, Ranking Member Rowe, thank you so much for joining us. Fantastic to get your perspective on this, and have a great rest of the day. Thank you.
Right. Thanks very much. It's been a pleasure to serve on this committee for the past 12 years. It's been one of the best experiences of my life. And when I leave the Congress in January, I'll continue to be working on veterans issues. So thank you very much for having me.
Thank you so much for your service, and thank you so much for supporting the veteran community for all these years.
Thank you.
All right. Well, that will conclude this morning's program. I want to thank all of our speakers for joining us today for our House Oversight and VA Digital Modernization virtual event. And thank you to everyone who has tuned in. We're having some great conversations on social media, so be sure to join that. And anyone that might have missed the start, you can certainly go back and start from the beginning to check out all the speakers, which were truly excellent this morning. I'd like to thank our sponsors, Dell Technologies, VMware, Worldwide Technology, NetApp, and Salesforce for their partnership on this event. Hopefully you got a chance to learn more about exactly how they're supporting different federal agencies at this significant time. We're grateful for their continued support. I'd also like you to encourage everyone to sign up for our series of upcoming virtual events. Our full list of events for the rest of the year can be found on our website at GovernmentCIOmedia.com. Our next event is in 2 weeks on October 1st on digital health modernization, with a special focus on how health and human services is utilizing technology to create solutions during this pandemic. So again, I want to thank you for joining us this afternoon, and we look forward to seeing you again soon. Thank you.